The mechanism of action of Venclexta is a complex phenomenon that is of great interest to medical professionals and researchers alike. This groundbreaking drug, developed by AbbVie and Genentech, is designed to target and inhibit the B-cell lymphoma 2, BCL2, protein, which plays a critical role in preventing programmed cell death, or apoptosis. Venclexta essentially restores the normal apoptotic process by binding to BCL2, allowing the cancer cells to undergo programmed cell death. This mechanism of action makes Venclexta a promising treatment option for patients with chronic lymphocytic leukemia, CLL, and other BCL2-dependent malignancies. Mechanism of action of Venclexta. Venclexta works by specifically targeting the BCL2 protein, which is overexpressed in certain types of cancer cells, including CLL. BCL2 is responsible for inhibiting apoptosis, the natural process of programmed cell death that helps regulate cell growth and maintain the balance of healthy cells in the body. In cancer cells, the overexpression of BCL2 allows them to survive and proliferate uncontrollably, contributing to the development and progression of the disease. By binding to BCL2, Venclexta disrupts its function and restores the ability of cancer cells to undergo apoptosis. This targeted approach allows Venclexta to selectively induce cell death in cancer cells while sparing healthy cells, minimizing the potential for off-target effects. This mechanism of action is particularly advantageous in CLL, where BCL2 overexpression is a hallmark of the disease. Targeted cancer cells and indications for Venclexta. Venclexta is primarily indicated for the treatment of patients with CLL, particularly those with the 17p deletion mutation, which is associated with poor prognosis and resistance to standard therapies. The 17p deletion results in the loss of a tumor suppressor gene called TP53, further promoting the survival of CLL cells. By targeting the BCL2 protein, Venclexta offers a novel therapeutic option for patients with CLL and the 17p deletion mutation. In addition to CLL, Venclexta has shown promise in other BCL2-dependent malignancies, including acute myeloid leukemia, AML, and non-Hodgkin lymphomas. Clinical studies are ongoing to explore the efficacy of Venclexta in these indications and expand its potential applications in the field of oncology. Clinical trials and efficacy of Venclexta. Extensive clinical trials have been conducted to evaluate the safety and efficacy of Venclexta in CLL and other BCL2-dependent malignancies. The pivotal Murano trial, for example, demonstrated the superiority of Venclexta in combination with rituximab compared to standard chemotherapy in patients with relapsed or refractory CLL. The study showed significantly improved progression-free survival and overall response rates in patients receiving Venclexta-based therapy. Similarly, the Viale-A and Viale-C trials investigated the efficacy of Venclexta in combination with azacitidine or low-dose cytarabine, respectively, in patients with newly diagnosed AML who were ineligible for intensive chemotherapy. Both studies reported improved overall survival and complete remission rates in patients treated with Venclexta-based regimens, highlighting its potential as a new treatment option for this challenging disease. Side effects and safety considerations of Venclexta. Like any medication, Venclexta is associated with potential side effects and safety considerations. The most common side effects observed in clinical trials include diarrhea, nausea, upper respiratory tract infection, and fatigue. These side effects are generally manageable and can be effectively addressed with supportive care measures. It is important for healthcare providers to closely monitor patients receiving Venclexta and promptly address any adverse events that may arise. Of particular concern with Venclexta is the risk of tumor lysis syndrome, TLS, a potentially life-threatening condition that can occur when a large number of cancer cells are rapidly killed, releasing their contents into the bloodstream. To mitigate this risk, patients initiating Venclexta therapy undergo a ramp-up dosing schedule, gradually increasing the dose over several weeks to minimize the risk of TLS. Close monitoring of laboratory parameters and hydration status is crucial during this period. Dosage and administration of Venclexta. Venclexta is available as an oral tablet and is typically administered once daily. The recommended dosage varies depending on the indication and the specific treatment regimen being used. For CLL, the dosing schedule involves a ramp-up phase to minimize the risk of TLS. It is important to follow the prescribing information and individualize the dose based on the patient's clinical characteristics and tolerability. Drug interactions with Venclexta. Venclexta is metabolized by enzymes in the liver, primarily by the cytochrome P450 system. As such, it is important to consider potential drug interactions when prescribing Venclexta. Certain medications that inhibit or induce these enzymes can affect the levels of Venclexta in the body, potentially impacting its efficacy or safety profile. Healthcare providers should carefully review the patient's medication profile and consider dose adjustments or alternative treatment options if necessary. Patient experiences and testimonials with Venclexta. Patient experiences and testimonials with Venclexta offer valuable insights into the real-world impact of this medication. Many patients with CLL have reported significant improvements in their quality of life and disease control with Venclexta-based therapy. The targeted approach of Venclexta, coupled with its favorable side effect profile, has made it a preferred treatment option for many patients. However, it is important to note that individual experiences may vary, and not all patients respond equally to Venclexta. Factors such as disease stage, genetic mutations, and overall health can influence treatment outcomes. Healthcare providers play a crucial role in guiding patients through their treatment journey and managing any challenges or side effects that may arise. Future developments and research on Venclexta. The mechanism of action of Venclexta continues to be a subject of ongoing research and exploration. Scientists are delving deeper into the molecular pathways and interactions influenced by Venclexta, seeking to further optimize its therapeutic potential. Combination therapies, such as Venclexta in combination with other targeted agents or immunotherapies, are being investigated to enhance treatment efficacy and overcome potential resistance mechanisms. Additionally, efforts are underway to identify biomarkers that can predict response to Venclexta, allowing for more personalized treatment approaches. By better understanding the factors that influence response to Venclexta, healthcare providers can optimize treatment selection and tailor therapy based on individual patient characteristics. Conclusion and final thoughts on Venclexta. In conclusion, Venclexta's mechanism of action offers a fascinating glimpse into the intricate workings of cancer cells and the potential for targeted therapies to disrupt their survival mechanisms. By unraveling the complexities of this process, researchers are unlocking new possibilities for the treatment of CLL and other BCL2-dependent malignancies. Clinical trials and real-world experiences have demonstrated the efficacy and safety of Venclexta, providing hope for patients with limited treatment options. As ongoing research continues to expand our understanding of Venclexta's mechanism of action and its potential applications, healthcare providers are poised to offer more personalized and effective treatment strategies. Venclexta represents a significant advancement in precision medicine, highlighting the power of targeted therapies in the fight against cancer. With continued research and clinical advancements, Venclexta holds the promise of improving patient outcomes and changing the landscape of oncology. Thanks for watching.